Hey guys, my name's Julie. Could you imagine a life without being able to use your words to communicate? Neither can I. So that's why I'm here to tell you today why it's so important for parents who have a child with a speech delay to get their children into speech therapy by age 2 for best results. It's my belief that if you wait until age 3, 4, 5, or the later toddler years, you may not see best results because the brain is already developing so fast. After growing up with an autistic brother who didn't speak until he was 5 years old, I've witnessed what works and what doesn't, and I've seen the growth since he started speech therapy when he was 2 years old. I want you guys to know how a child is diagnosed with a speech delay, what funds can cover this speech therapy, and why it's so important for you to get your child in therapy at age 2 versus age 5. The truth is, you never know if you're going to have a child one day down the road who may have a speech delay until you actually have one. Too much knowledge on the topic is not going to hurt you. You may benefit from hearing what I have to say because at one point in your life or another, you may come across somebody who has a child with a speech delay, even if it's not your own. And how cool would it be to be able to provide someone else with the right information to get their child speaking? Sometimes we don't know how to go about a situation because we can't identify the problem. If your child is 2 and you're seeing no speech at all, a stutter in their speech, mumbling versus words, or very minimal words in general, you may want to consider getting your child evaluated by a developmental pediatrician. Okay, so now that you saw your pediatrician and you have your diagnosis in your hand, the problem is identified. So let's talk about the solution. Getting your child into speech therapy by age 2 is so important. By waiting 2, 3, 4, 5 extra years, they may have already developed their speech habits, and the brain can't possibly take in any more information at age 6. It's actually a proven fact that once a child reaches age 6, if they're not speaking at all, there's a good chance that they won't be speaking for the rest of their life. And that's not to say they can't learn few words and phrases, but by age 6, your speech is pretty much developed for the rest of your life. That's a scary thought. So how do you pay for all these therapies? They can be expensive with private pay. So if that's not in your budget, don't worry. There's an ESA award for kids with a speech delay or any disability in general. You go online and you apply for this, and they take 30 days to view your application. They look at your speech delay diagnosis, and they give you a grant, which will help you pay for any therapy that will help your child start speaking. If you're not looking into the ESA award, there are certain places and facilities such as UCP that will accept insurances, but you'd have to do a lot of research to find which places match your insurance. Another problem you may be thinking right now, I work a 9-to-5 job. How could I possibly find time to do this therapy? Well, if 9-to-5 job doesn't allow you to have a therapist in your home, I understand that. So you should look into other places such as Orion Care Solutions or another company that can send a provider out on a Saturday or Sunday for speech therapy. There are even some facilities that are open on Saturdays, but not Sundays. So there's no excuse. All right, so you are the parent and you're your child's biggest advocate. And if your child can't verbally communicate in the right way, it's your job to get them where they need to be. Starting speech therapy at age 2 will get them the perfect amount of time to start speaking. So you're ready to take action, aren't you? So you're going to log on to www.arizonaschoolchoice.com to start your free application to get approved for the ESA award. The clock is ticking and your child has things that they want to tell you. So it's time to get them talking and get them the help that they need. I appreciate the opportunity to talk to you guys today about what the steps are on getting your child evaluated for a diagnosis of a speech impediment, what to do once you have the diagnosis, and how to pay for it. Thank you so much.